Welcome to PodTox. Today we have Brandy down here at the. I flipped the screen, I'm telling you. Today we have Brandy, and she is going to talk to us about chronic pain patients and everything that they go through whenever it comes to their struggles with getting medication and just living normal lives. So, Brandy, the first thing we want to talk about is just where everything started for you. I know as a child you were like, what, 9 years old when you got diagnosed with scoliosis?
Yes, I had already been complaining of back pain for a few years at that point, but doctors were like, "Oh, she's an athlete. She's just sore." And then the my one shoulder was crooked, so my clothing was falling off, and back to the doctor. Oh, she has scoliosis, but it's normal. She'll probably grow out of it. We're glad you keep her active, set me loose. And then my mom took me to the University of Michigan Spinal Clinic, and they're like, yikes, her curve is very pronounced. And unfortunately, when a child goes through puberty, it usually gets much worse. So we're going to send you to a different doctor that's been doing this for 50 years. So, we're going back to this man was doing scoliosis surgeries in the 50s, 60s, 70s,
Wow.
80s. And so off to another doctor, and they're like, oh, yeah, this is bad. We need to brace you. So I wore a horrific back brace. It's called the Milwaukee back brace. If anybody has watched Romy and Michelle's high school reunion, that was me. And I wore a back brace that could not be hidden. It went all the way around my neck, metal rods. It was form fitted all the way to my hips with plastic and metal. I had to wear it 23 hours a day, so I only could take it off to shower and for sports.
Did that cause anxiety for you? Because I know that if I had to be in a contraption like that for 23 hours a day, my anxiety would be through the roof.
Well, I mean, I think back to being 10, 11. I'm in middle school, and it was the reality was every teacher in middle school had to tell all the other students, why does Brandy have this ridiculous back brace on and what is going on with her?
Right.
Embarrassing. And then obviously kids are kids and they're going to be mean and they're going to make fun of you. I really had to learn to be protective of myself and defend myself in the sense of like, this is kind of where my humor came from, just to make jokes about it. And but boys were really mean to me, so I would kind of be like, listen, I'm better than you at basketball, so who's the joke?
Was that hard whenever you got into the puberty years and it was like, oh, I'm trying to find a boyfriend and stuff like that? And I don't know. I feel like some people, if they have any sort of disability, they get looked down on, and that was a very apparent disability.
I definitely was put in special education classes, sixth and seventh grade, because once I endured the spinal fusion, which I'm coming up on that anniversary is 11/11, 1993, I missed 4 months of school. So I had to be in a kind of a class, for special education kids and the troublemaker kids. But you know what? I think back, and even though kids were really mean to me, I just think because I was athletic still, no matter what, I just really didn't care. But I think that, again, that's just why I am the way I am today. I'm really quick and witty with comebacks because I've heard it all. And the best thing, the best advice my sister gave to me, because I definitely recall we were down in Florida. My parents took us down to Florida before my surgery. I wanted to go to Busch Gardens because I wanted to go on roller coasters, because once you're fused, you're not supposed to do roller coasters. And I remember I was crying on the beach saying people are going to make fun of my scars and boys aren't going to like me. And my sister's like, no, you use your scars to your advantage. It may be an opportunity for people to come up to you and ask you questions. Why do you have those scars? And that's always been my go-to, like I'm not afraid of my scars. They're my tattoos, right? It gives reasons for people just to be standing behind me and be like, whoa, that's some gnarly scars. What happened to you? And just to spark a conversation. So I kind of flipped it to my advantage.
So you've had 3 spinal fusions in total, correct?
3 total.
Wow.
What's the recovery time for something like that? What life changes did you have to do every time you had to go through that operation?
So in 7th grade, out of school for 4 months, I could not play sports. But after that, it was no football. So I was like, all right, guess I'm giving up my football career. No more gymnastics, which I did do gymnastics as a child, but I was very flexible. I mean, I could bend myself in ways that other kids couldn't. And they're like, you can't do that anymore. And, they really weren't a fan that I played basketball and soccer. But I said, too bad, so sad. I'm still going to do it. And I just had to be more aware. I definitely played volleyball too, but in volleyball, you're kind of scrouched over. It's a lot of lower back stuff. So that wasn't something that I wanted to pursue. But yeah, 7th grade out for 4 months. My dad had me, training within months later for track. I was back running track. Took the summer off of soccer, and then in 8th grade, back in the saddle, playing every sport imaginable. I went on to get a full ride scholarship to many colleges throughout the United States. I wanted to stay close to home because of my back problems. I played AAU basketball with a lot of Division I basketball players, and it was kind of the hard thing to swallow, though, that a lot of these Division I colleges were looking at me like, she's got a bad back. I don't know about this girl. But I ended up playing for Division II, and it was not easy by any means. The reality was, I'm 5'6" when my spine's looking good. I should be at least 5'8", 5'9" if I had a straight spine.
Did your parents, I know that you were saying how your father was supportive and everything, but did they ever fear you playing sports because of all the things that you've been through and like almost wanting to protect you a little bit more?
Yes and no. I
Okay.
think because my dad was not only my personal trainer, he was my coach in basketball and track, but he also coached the boys basketball, and then followed into my high school career with varsity boys and varsity girls. And then obviously because my dad's a coach in the city, everybody knew him, so other coaches knew my story. I will say, I mean, I know my mom would cringe when I would get hit on the basketball court,
I'm sure.
but I would just get back up and keep going.
See, I love that.
But unfortunately, a lot of girls, I was in the Detroit Free Press often here, and they did a story about me and my back problems and my dad coaching, and girls were told by their coach to get my back to take me out of the game. So one game, a girl straight up punched me right where my rods are. And I turned around and I called her some names. I said, you just hit metal. Are you okay? And I like, went, I went at her. My dad lost it. My dad got a technical. My dad got thrown out of the game. It was a huge ordeal, actually. So girls were always trying to take me out by attacking my back.
You would think, I understand whenever you're younger and you're trying to do something like that, there's not as much thought that goes into it, but like for the coaches to say that, those are grown adults basically saying, go completely ruin the rest of her life. Like,
Right.
that's crazy.
Yeah, my
Wow.
dad had some choice words for him.
I'm sure.
We-
Now, do you have siblings, correct?
Yes, I have an older sister. She's 6 years older than me.
Do you ever feel like you got treated differently by your parents because of, your disabilities and stuff like that? Like not treated differently, like, I mean, just like more protective. Were they more protective over you?
I think my sister would have a lot to say about this. I think she's openly said, you were so easy on Brandy and let her do everything, and you didn't let me do nothing. And I had to work hard for my first car, and you gave her that car. I am very fortunate. My parents were always very supportive, and I am the baby, and of course,
Yeah.
they've seen all my struggles though through adulthood living this way and the realities that I faced, of just like it's really hard to navigate life when you have existing disabilities, whether they're physical or mental. People can be really cruel. And the reality of them seeing me struggle with the fact that a lot of people just don't believe me. Like, you don't have anything wrong with you. Look at you. You did this, you did that. Well, then you can do anything. Like, no, I kind of can't. I have my limitations. I'm thankful I had a really good family. They were always incredibly supportive, but I also was the type that I wanted to go live my own life. I wanted to do my own thing, but when things went bad, I had to come back here to depend on my family.
Do you think that all the sports and everything, because I know whenever you had your surgeries and grew up, things kind of progressed in a negative way for a little bit there. Do you think all the sports and everything are the reason you can walk today? Because they told you at one point you weren't going to, right?
My whole life, they were like, by 30, she's done. She's going to be completely wheelchair bound. Now, back in the 80s and 90s, the go-to thing for all my back problems besides scoliosis was Brandy has a hole in her spine. That hole never had a name, which it really wasn't until the past 25 years that spina bifida occulta is what I have. So it was so crazy to have a doctor. I think I was 20, 21, 22 when a doctor is like, hey, you have a hole in your spine. I was like, obviously, that's spina bifida. I was like, wait, what do you mean? Because most people correlate spina bifida as the most severe form, because most spina
Right.
bifida patients cannot walk, right?
Yes.
And I'm like, well, what do you mean? So occulta, what does occulta mean? It means hidden. So that reality was very strange for me because I was always told I had idiopathic scoliosis, which means no known cause. There was always a cause. So for all of these years, I did all this research because at 12, became very obsessed with my spine. Why? Why me? How do I fix it? What do I do? So I did all this research. And then if I just would have known this whole time the cause was the spina bifida occulta, that really would have saved me a lot.
What test showed that? Like how come you didn't have that test prior when you were having issues?
Well, let's start when early 80s. Okay, I was born in 1981. Now they can test, if you're pregnant, they can test your fetus for spina bifida. Okay.
Yes.
And they didn't have those tests back then. So if they'd had those in 81, my mom would have been told I had it. And what do? They give you the option to abort the baby. That's life. That's really a thing that happens today. You think back to that and it's like, wow, would my mom made that choice to say,
Right.
this is going to be devastating life for my daughter. I'm just going to abort her. Like those are really kind of like whoa, things to think about.
Yeah.
So at any rate, the hole always showed up on MRI and x-rays. It was
Okay.
always there. Doctors didn't know what to call it. So it was just Brandy has a hole in her spine. Now, they never denied it caused me pain. They never denied that it was going to be a bigger issue as I age.
Yes.
No doctor ever denied that to me. They, again, it was just, I think back, why did they say I was going to be wheelchair bound by the age of 30? Why did they tell me I'm going to need all these other surgeries? Why were doctors always dumbfounded that I can walk? You know,
Right.
like I've heard that a million times over. Brandy, how are you walking? But when it came to sports, like that really shocked doctors because they're like, how are you doing this? And I just said, well, I do it because I love it and I'm good at it. And they were like, okay. But the surgeries, you know, post-op in the hospital, every nurse was like, man, I can tell you work out. Those little leg muscles are working hard. So it was definitely drilled in my head to keep active, keep exercising, and don't gain weight. Don't have a baby. You can't do that, Brandy, and keep those abs
So
tight.
when you were pregnant, were you fearful of your, daughter having spinal bifida? Were you fearful of her having the same issues as you?
Freak out mode. So
I'm sure.
it was not a planned pregnancy, special surprise, and I was terrified. So immediately I called my chiropractor slash supplement doctor here in Michigan because now I'm living in Las Vegas.
Okay.
And Dr. Tent is his name. He's known me and my family forever. And he prescribed me a special supplement protocol, which majority of it was a high amount of folic acid because folic acid is what forms the spinal cord.
Okay.
So I did all precautions to make sure. I was terrified. I was absolutely terrified because that thought ran through my head. What if this child has spina bifida? Because can I physically take care of a disabled child in my condition? I already, I
Right.
never got assistance. I never got disability. I was already denied all those things. So that kept playing through my mind that the government's not going to take care of me. They sure as hell aren't going to help me out with a kid. Yikes, what am I going to do? So when I went through that testing and it came back negative, what a sigh of relief. I only had one child because I really was scared that if I had another, can my back handle it? Because this had to be a C-section no matter what. No doctor was going to let me push out this baby with my back. I just couldn't go down these roads again. And,
Yeah,
doctor.
that's a lot on your body. That's a lot. Pregnancy must have been so much on your body with your back, carrying the extra weight, all of it.
I had a special pregnancy back brace that I wore, and it was helpful.
Good.
I have done quite a few videos talking about my pregnancy. When the minute I found out I was pregnant, I was taking a very low dose of hydrocodone. I immediately stopped because this is before social media. So all I ever heard was,
Right.
your baby's going to be addicted to drugs and they're going to take it away from you,
Yeah.
And I was like, oh my God, like, what's going to happen to me? So I stopped. But that turned into I fainted at work. And I was hiding my pregnancy from my work in Vegas because, you can't be a
Yeah, the
female
service
Vegas
industry.
pregnant. Yeah, you better not get pregnant. They're going to
Right.
kill your ass. And the dad was a bartender with me. So that was like double whammy because if they find out I was a waitress, he was a bartender, and you can't work together. So I fainted. It was a whole deal. I went to the hospital and anyways, the whole world found out I was pregnant, and they immediately moved me. They put me on the 4 and 5 a.m. shift in Vegas.
What? That
Yeah.
was nice of them,
Oh,
right?
yeah, because that made sense. Yeah, let's let the pregnant girl that has
Yeah.
those back problems come into work and deal with everybody just faded at 4
Yeah.
and 5 a.m. But I had to do it. But I was forced on bed rest at 5.5 months. So there was no more working for me at that point.
So what happened with the pain meds throughout this period? Did you tell your doctor, "Hey, I want to stop these," or did your doctor suggest it, or?
Actually, I've never been a pill person. Let's go back to teenage years. I wasn't even a fan of Tylenol or Aleve. They didn't work. They did not work. You know, So I learned that as a child, like what's the point of taking this? It doesn't help me.
You learned how to cope on your own and deal with that high level of pain.
I did, but it was not easy. I mean, I have many teachers on Facebook that have followed me and messaged me and be like, "Oh, honey, I seen you struggle in school. I wish they would have treated your pain better because I knew you were hurting." Anybody that was a part of my life, they always knew I was hurting. But I masked it. I wasn't going to sit there and cry to people. I just learned to suck it up and shut my mouth because, well,
Right.
what else was I supposed to do? And years of therapy, I had to go to a therapist to kind of learn to cope with the reality that I was facing.
How much help was therapy for you to give you those right coping mechanisms and tools?
I mean, I absolutely find therapy to be incredibly helpful. But the one thing that I've ran into is these therapists don't understand disabilities or how I am, like, why I have anxiety, why I'm in pain, or if I'm not on pain medication. So many therapists pushing me onto psych drugs. I'm like, dude, I
Right.
don't need psych drugs. I need my pain to be controlled. And I was a victim of psych meds in my early 20s. Doctors weren't prescribing me. Oh, opioids were never my first line of defense ever. It was everything else but that. And I was heavily overly medicated by psych meds. And I don't ever want to go back down those roads again.
What experiences did you have when you were on the psych meds? Like, was it messing? I've been there before where I've had to take psych meds like that for pain, the same kind of story. And literally, I started hallucinating. Like, I was not myself. It was like an outer body experience.
I was weird. I have a big personality. I'm very outgoing. I had no emotion. I wasn't sad. I wasn't happy. I always said I was a zombie. I was like white as a ghost. I wouldn't eat. I'm a pretty small, petite person, and my weight just went down so much. I was suicidal. I wanted to kill myself. And I openly did tell one of my doctors that. And they said, well, we want to send you to a psych hospital to get evaluated. And I said, okay, I don't want to hurt myself. I want help. And when I went to the psych hospital, which I'm from Metro Detroit, this was on 8 Mile. It was called Kingswood Psych Unit or whatever. Going to, they picked me up in an ambulance. The guy that was in the back with me, whoever this man is, you're just amazing and I hope you're well. But he looked at me, he said, honey, it's okay. It's okay. You're going to get, it's going to make myself cry. He's like, it's okay. You're okay. We're going to get you through this, okay? Your life is worth living. You're going to be okay. I just thought that was really sweet, thank
It
you.
was because you're fearful. You're in an ambulance. You're going somewhere where it's known to you. So it's a lot.
Yeah, but that being in that psych unit was terrifying. I'm not gonna lie, it was terrifying. And it was kind of like, oh my God, I don't want to be here because some of the people I was in the room with they were scary. I'm just gonna say that as nicely as I can. They were very scary and they were scaring me. And I just remember going to that psych doctor and I was like, I want to go home. I really just needed help. I'm like, I'm in a lot of pain. These are my diagnoses. And I'm like, you guys got me all doped up on psych meds. And I'm like, I don't think these psych meds are helping me. And I'm like, I think I need my back pain to go away, sir. I just want to leave. And it's never that easy, right? So long story short, I eventually got out of there. And that's when I came home and I just took all of those meds and just threw them out. And I said, Mom, Dad, this is not right for me. I need real help and this ain't it.
How old were you at this point?
Yeah.
I was 22, 2022, 21, 22.
Okay.
Who
Yeah.
did you have that was like actually there for you? Because obviously you had sports and everything, but whenever you did hit those points where the pain was just too bad or your mental state just wasn't right, who was like that biggest supporter besides your parents?
My friend Holly, she's here on TikTok too. She was a big help for me. And I think I had cats at that time and loved my cats, just talking to them and then licking the tears off my face.
Oh.
Um, but I really turned, music has always been a big part of my life, kind of just like take me to the club and let me dance away my problems. Like I was really into like the rave culture and EDM but I'm also into hip hop music too. Um, and I met a lot of great friends from those worlds, right? That's why I became a bartender. I'm like, I love this place. Like I
You
love
have
these.
that outgoing personality. You do. You can like vibe with people good.
I have friends from all across the map. You know what I mean? Like all walks of life. I can mesh with anybody and everybody.
What challenges are you facing today since you've been through all of this? Do you have more that can be done to kind of help you, or are you at a standstill?
Well, I endured at 23, I ended up having the scoliosis rods taken out because that was playing a big role in my pain, the rods itself. So I said, let's get those suckers out. And so I went through that and then I just up and left Michigan. I was like, just sick of the crap here, sick of the weather. Cold weather is hard on me. So I was like, we're taking my show to Vegas. So the third spinal fusion that I was masking, with medication, spinal epidurals, etc. I knew it was going to come at some point in my life. So at 35 is when things really kind of went downhill with my pain wise. It just the reality of I was becoming paralyzed waist down and just I wasn't walking as well. The pain was unbearable. But I wasn't on pain medications. Like I've been on pain meds. I take myself off pain meds. I
Right.
live a few years without them because, of course, I've already heard for so many years those pain meds are making your pain worse. So
What's
I'd be
your
like,
experience with doctors when you tell them that, like, they see all these diagnoses, they know that they're very severe issues, they know that you go on and off of meds? Were you ever recommended, like, that wasn't a good idea, or you should probably stay on them, or stay, like, how were you treated?
a little of both, to be honest with you. I had some doctors that are like, those meds are bad. You shouldn't be on those. But then I had other doctors being like, you absolutely need
Right.
to be on these, Brandy. Like, hello. And in Vegas, I was with the current spine doctor in PCP for 15 years. They met me before I got pregnant, went through the pregnancy with me, all the way up leading to that surgery. So they really watched a big chunk of my life.
Yeah,
And
you grew up with them,
right,
essentially. Yeah.
I did. And every time I would go off the meds, they would yell at me. They're like, look at you. You're a mess. Why are you doing this to yourself?
No.
Because I'm like, because I like to experiment with my body. I like to see how much I can handle. And I'm kind of thankful I did things like that because that's kind of been crucial for the fight that us chronic pain patients are in today. Because it's been benefited me to show in my medical records, like, well, this girl has gone off these meds, and then this problem happened to me, and then it's God, I'm so thankful I did stuff like this because it validates why I am so heavily involved with fighting for opioids today.
So that gave you the passion to start advocating and start advocating for others, correct?
Yeah, but I've really been advocating since a teen. I was always recommended to talk to other teenagers going through a scoliosis spinal fusion by the facility that did my original surgery. I was like on a list. And then my high school would occasionally call me, be like, hey, we got a girl here that's going to have a scoliosis spinal fusion. Can you talk to her?
I
And
love
then,
that you do that because you know what it feels like to be in those shoes. You know how lonely it is.
yeah.
You know how mentally draining and exhausting it is, but you're educated. So you, with your education and experience, you can really help people, and that's amazing.
And yes, and I, obviously, I wasn't personally affected by the CDC opioid guidelines in 2016. I actually didn't even know that was a thing. I didn't know it was a thing until I was approaching my third spinal fusion in 2018. Now, in 2016, without me knowing, I just took myself off of pain medication. Why? Because dispensaries were popping up everywhere in Vegas, weed dispensaries, and my man was heavily involved with that industry. So I was attending all of these amazing seminars in Las Vegas, and I was learning about CBD, and I was learning about all this stuff, right? Rick Simpson oil, and I got all this stuff for free. You name it,
Wow.
I had it, and it, didn't cost me a dime. So I was giving medical marijuana the full chance. And 2018, when I had this third spinal fusion, if anybody's had spinal fusions, of course they're going to hook you up to a morphine drip. Well, because I've been there, tried that, and done it, I'm not a fan of morphine drips. They make me hallucinate, and I'm really drugged up. I'm just not a fan, okay? I know they do the job, but because I'm crazy, I wanted to experiment. So after 24 hours, I asked them to remove the morphine drip. And the nurse was like, why? Why?
Right.
And so my surgeon came in. He's like, what are you doing? And how are you going to treat your pain? And I had him grab my little backpack, and I had so many edibles, and I had CBD oils, and I had all the tinctures. And I'm like, I'm going to do this. And he's like, I think you're crazy, but I'm going to let you do it. I'll be back in tomorrow to check in on you. So I did it for 24 hours. He came in the next day. My body was going into shock, and I was going to have a stroke.
From
And
the pain, correct? From the high amount of pain.
yep. And he's like, again, Brandy, I think you are crazy. I commend you for trying this, but no, you need to be on pain medication. And I said, well, I don't want the morphine drip back. What should I do? He's like, I think it's time you try Oxycontin. Now, this is a drug that I could have had in my 20s, but the way it was described to me was it's the best of the best. Once you go to Oxy,
Right.
there's nothing else better.
Yep.
So I, in my head, am thinking, well, I know I'm going to have another surgery. I'm in my 20s. If I try this now, what am I going to do when I do have another surgery and the pain gets worse? So I denied it. No doctor hassled me. They weren't shoving pills down my throat. They're like, okay. Like people portray that drug, that doctors were just throwing it at you. And that was not my experience. It was a recommendation, but they weren't like pouring it down my throat. So when he said it was time to try an extended release Oxycontin at 10 milligrams, that's it, I said, fine. And I tried it, and this was a 5-day stay in the hospital. They kept the morphine drip. Now they lock it up, right? Because no one can steal it. So it was next to me in a lockbox, and I survived. Like the drug does the job. It literally takes your pain away. It's been very frustrating, all this pushback on OxyContin, because it's a fantastic pain reliever. it saved my life.
It does work for pain. It absolutely does. I could attest to that.
And a lot of it back in the day, like you said, the doctors weren't shoving it down your throat. There were some doctors that did that, of course, but a lot of it was they just weren't as careful when they were prescribing it. So a patient would come in and say, "Hey, I'm still in a lot of pain. Can you up my dose?" And they would just say, "Sure." And
Yeah.
it kept recycling. It was a very weird balance that I don't think a lot of people know about.
Yeah, I'm not going to sit here and deny that doctors didn't play a negative role in prescribing it. I know, like, I'm from Vegas. Like, I worked in the club scene. People do a lot of drugs. Like, psych doctors would roll into clubs with handfuls of Adderall and give it to all of the people working. I seen it. I waited on the DEA. The DEA was doing drugs in the booth. Like, like that's politicians. Do you think they're clean? They're not, dude. They're doing
Right.
drugs in Vegas, and I've seen them. That's why I'm so crazy right now about everything happening, because it's like you all have benefited from all of this, and you all do these same drugs. Why are you vilifying the drugs that you know people do need? Like, what are we doing? So that's why it's like, because of my Vegas experience, people do go to Vegas to party, right?
Yep.
So it's like, I think I've waited on countless celebrities, politicians, DEA agents, princes from other countries. Like, I mean, people like to have a good time, and I don't think there's anything wrong with that. Let people have a good time. And again, if it crosses the line, the help is available. But to vilify overall that drugs are bad is crazy to me, because obviously we're at a dangerous point that these drugs are poisonous, right? There's no safe supply. It's not just cocaine anymore. It's not just an ecstasy pill anymore. It's cut with this illicit fentanyl, and now you're dying. So there's no safe supply of just overall drugs, whether it's illicit or legal prescriptions. And it makes me upset, because just because somebody does drugs, whether it's to treat pain, whether it's to have a good time, I am on the side of who cares? I don't care. Do what you do,
Right.
like, I just, be safe. Like, I was the friend that was always like, hey man, I'll just drive you. I don't want you driving home all jacked up. I got you.
With all the limitations that are on the pain medications, you're having all the chronic pain patients go out onto the street because they can't get their pain meds. They just get ripped off, and then they end up ODing, and or who knows what happens. But the other end of that spectrum is they end up getting on like subs or something, and the problem is a lot of doctors don't know how to actually prescribe subs.
For
So they
pain. Right.
right. So it ends up not working, and they feel like they're at a crossroads and can't do anything.
Yeah, I mean, I definitely have touched on my beef with pain management overall, because, pain management was introduced to me at 12 post-op, right? And then back in the saddle again in my early 20s. And then coming back to Michigan, I was forced into pain management. So no primary care physician would prescribe my medication. And I was big mad. I was big mad about that, because I have every reason to be big mad, because I have found that a lot of pain management doctors do not understand pharmaceuticals. They're very ill-informed, no knowledge, willy-nilly, and I have caught them trying to overdrug me with amitriptyline, or telling me to take stupid drugs that make no sense. And if I didn't know what I know, they would have hurt me. So overall, pain management needs to completely be remodeled, and we can't just be tossing out you should take 300 milligrams of amitriptyline. Like, bro, you're gonna
Right.
kill me. But when it comes, I've had to learn a lot in these recent years to understand, buprenorphine and methadone. And, I have this beautiful notebook, which I have
I
like
knew you were going to have that.
I'm always taking notes because my brain, it's hard to retrain my brain in certain ways to understand. But I've been really working hard to understand why the CPPs are so mad and why the SUD community people, they're mad at us, right? There's been a lot of beef going
Yeah,
on.
why can't the two communities intermingle and mesh? Because I feel like there's so much in common. Like they kind of
Well,
cross over sometimes.
the biggest problem that I see is the only reason that they're having this argument is because it's one, misunderstanding. That's a huge part of it. And two, it's just a big blame game, and especially places like TikTok and the internet in general, once you get into a blame game like that, it gets blown out of proportion. When the struggle is the doctors. I mean, that's the real problem.
It is, and the underlying, problem is drug policy. This is all going back to drug policy. And I really, it's hard to understand that. If you are a disabled person and if you've been taking hydrocodone forever, and you're like, well, what do you mean drug policy? This is a prescription medication. What does this have to do with drug policy? And I've really had to learn so much. And there is overlap, right? And it's just like all these laws that were written years ago and the war against drugs. And overall, it's a lot, right? And a lot of us are doing our best to educate, to get people to understand. But it doesn't matter. We get attacked, that community gets attacked. There's always going to be beef. And I understand the beef. And I would like to get into that.
Sure.
We feel that we're just being left to suffer. Where the substance abuse community, you guys have so many resources and so much help available. I mean, I last night spent 5 hours digging deep into the White House information. And this had to do with, House Committee on Oversight and Accountability and the Scott A. Brinks, the Regulatory Drafting and Policy Support of the DEA, the Office of National Drug Control Policy. I cannot find anywhere why they are cutting prescription opioids. I can't find any of that information.
There's no real reason.
But when it comes to people that are substance use community,
Yep.
you guys are getting anything and everything. You need buprenorphine, you got it. You need your methadone, boom, you got it. We need somebody to open their arms up to our community
Right.
to please help us. Because I did some undercover work. I started calling some MAC clinics here in Metro Detroit, and I just said, hey, this is who, I'm a chronic pain patient. I can't access my pain medication. I'm looking to come there to get help. They don't want me. They don't want us. Or they'll say, sure, but we don't take your insurance. So it's going to cost you like $18 a day. Well, we're talking about disabled people that are on a fixed income or disabled people that can't drive. How are they going to get to a clinic? So there's a lot of problems here that I want addressed. And that's why I'm so thankful you all had me on, because this is why the CPP community is big mad, because we're not getting the help that we need.
What can we do to help?
Well, we've been tagging the ACLU, and I've sent them way too many emails. They don't respond. So they're making me mad. Like, how do you all not respond? Because the ACLU has on their website drug law reform. And they've been trying to, work on all of this. And it says, I'm trying to enforce the drug laws. The government violates the fundamental rights of privacy and personal autonomy that are guaranteed by our Constitution. The ACLU believes that unless they do harm to others, people should not be punished, even if they do harm to themselves. Okay, well, we got disabled people on the verge and already have committed suicide. Why won't you help us? So I'm not understanding, because everything coming out of the White House is all great. I'm not, no, there, I can't say there's many true CPPs that are against Matt. They're not. We're not, guys. We love that you're getting better. We love to see you recover. We always have. We're proud of you. We're proud of you. But we want you all to help, because we feel like we've been fighting this fight for years at this point, and things just keep getting worse, and we keep hitting roadblocks.
Here's the problem I'm seeing, and I have no idea if I can actually explain this right, but I feel like the DEA decided that since pain pills were this horrible thing that were affecting addicts, they grouped pain patients in the same way and put us all in one category in their eyes, which it's not one category.
Right.
So because they grouped us in one category, they found that subs and methadone and all that, oh, those are helping the addicts, so they have to help the chronic pain patients. And in a way, yes, they do, but not to the extent that it's helping the addicts. So there needs to be another branch off of that that can actually help the pain patients as well.
Thank you, Kyle. Yes.
Well said.
Well said.
You nailed that.
That's what we're looking for, but we're not being heard. We are being taken down by prop Andrew Claudia. I know Claudia goes big and hard at Andrew Claudia. He's the reason for all of this, guys. He's the main player of why the CDC guidelines came out.
Who is that, for people that might not know?
He's the one that played a big role with the 2016 CDC opioid guidelines. And he has an organization called PROP, P-R-O-P. And he has openly said that he doesn't care if we die. So there's that. He also thinks that people that are Black, they're thank God nobody prescribed them opioids, because they don't deserve it.
Wow.
So when we say that this is a hate organization, we mean it. This guy is full of hate, and he rather see our community just flat out die. And unfortunately, though, because in state of Michigan, we got University of Michigan Open, that is, they're anti-opioids too. So we're up against government. We're up against the government. And we got the DEA playing doctor. So how do we fight this?
They're controlled. So many doctors are fearful to write certain medications because they're like, oh, well, I'm not losing my license over that. Well, what do you, like, certain people need certain meds, like.
They want to prescribe that med, but they aren't going to, because they'll
not
lose
all of them, though.
Right, not all of them. But even the good ones, if there's any pushback at all, I know a lot of doctors on here go to their state senator and whoever and talk to them and try and explain to them how all of this works with substance use disorder and pain patients. But if they push back the wrong way, they can write one prescription and they'll be gone. They'll get raided in a heartbeat and it's over, whether they did something wrong or not.
And this is the problem, because Claudia's organization, the Doctor-Patient Forum, because we are pro-opioids, we are pro-medication, she can't get government funding. So, if you are pro-opioid right now, they are going to shut you down in your voice real quick. And that's what we've been experiencing. And I've been experiencing, I've done multiple news interviews, and they only share that little bit that's going to fit their little bit of narrative when there's such a big short story that they don't want to share. Disabled agencies are what? Government funded. And most of them, I say all of them, except for the Independent Living Council, won't say a word because they don't want to lose their government funding in defense of us. So disabled agencies, severely disabled people are just being told, too bad, so sad, good luck on your journey. So what I experienced moving back here was flat out discrimination. I called 53 doctors, and they said, what did they ask you? Oh, what's wrong with her? This is what's wrong with me. What kind of medications is she on?
Right.
The minute I said
Yep.
opioids, they said, we can't treat people like you.
I've had that happen as well. And it's like you no matter what you do, the door is constantly slammed in your face. You try to advocate, you get blocked. Yep.
Flat out, we're being told we don't want people like you. I mean, what part, in what world is any of this normal behavior? Especially to the disabled community, they have multiple things wrong with them, and you're denying them access to medical care. What are we doing? And this is why our community is so mad, because we are fed up. I am fed up here. I am fed up with doing all of this work for free and just being shut down in every freaking direction. It just being told, ew, oh girl, you got a drug problem. You should probably go to rehab. No, I have a bad spine that I was born with, and you would never be able to walk in my shoes ever. And here I am. But it's just the constant doors being slammed in our face. And I go up to our state capitol. I've been attending these opioid advisory committee meetings. This has to do with the opioid litigation money. And this is another problem. Like, America's addiction to money is ruining our country. And they sued all the pharmaceutical companies, right? And we're not in denial. We're not saying they did any, they were clean. Okay, they did things right. We're not saying that. But good God, this was all about money. This wasn't about helping anybody. So the state of Michigan alone is getting $788 million. There is not one pain doctor on that board. They are all psych doctors. And a majority of these people are a parent who lost a child to heroin. All that money is going to go to who? It's going to go in their pockets. Because I broke it down. As much money as the state's getting, if you are somebody with substance abuse issues, you shouldn't have to pay a dime. You could get all this covered for free because the state of Michigan has more than enough money. So all these directors of addiction and recovery centers are coming up there saying, hi, we need money too. Oh, sure, here's your money. What do you think you all are going to, what do you think these people are going to do with this money? They're going to give themselves a nice raise because their job is so hard. And in return, they might maybe put up another building. They're going to employ more people. But what I'm finding is that these people that need the help from that community, they're like, what are you talking about, Brandy? These aren't free services. They're telling me I have to pay for these services. I'm like, they have more than enough money. This should be free. So
especially on a limited income because you're disabled. My God, it's literally, wow, that really infuriates me. Somebody asked a good question. Where is the line drawn when it's determined OUD or SUD?
Well, and there's a lot of gray area with that, right? It's like, how often are you coming into the doctor to say you ran out of pills early, right? They do keep track of that stuff. And unfortunately, there are disabled people that have crossed over. But then there's a problem. Maybe all that doctor needs to do is give them a higher milligram of that medication, and maybe they'll be just fine. But I feel like doctors don't have that leeway. So it's just pushing you straight into, oh, your SUD. Because that
Right.
did happen to me here in Michigan, actually. I got tricked and I caught it. I went to a pain clinic, right? First doctor, you only take 2 medications. Oh, I thought you would be on so much more. No, sir, just 2 meds. He's like, well, listen, I have a more experienced, the guy that runs the show. He's great. I'm going to send you to him. Okay, go see that guy. Oh, we have this recovery center. So in my head, I'm thinking recovery from surgery, physical therapy.
Oh, yes.
Okay,
Like
I
a
didn't.
rehabilitation center.
Yeah, like, okay,
Yes.
cool. One-stop shop. You guys are going to give me mental therapy. You're going to give me physical therapy. This sounds amazing. So I show up. This was not a recovery center for people post-op from spine surgeries. This was a recovery center because they were trying to label me that I have opioid use disorder. And this is what they wanted from me. I had to go to this clinic 5 days a week, 8 hours a day. And I said, I'm in the middle of a disability case. If I can't freaking work full time, what makes you think I could be here like this is my job? I
Yeah.
seriously threw the fucking clipboard and I got me and my walker strutted out of there. But
Wow.
it was so insulting to me because they tricked me. And I'm like, and this is really what's fueled this fire in me to think and to know they're tricking pain patients to say, nope, you're addicted. You need recovery. You need help.
Well, and part of that is so many people don't know the difference that, which no matter how many times I try and explain it on here, it's every single time I talk about that, it's stonewalled and I get like 200 views. But so many people don't know the difference. And I think the other problem is doctors, it's not always that doctors don't know or don't want to help with something, they don't know how to help with something.
Right.
And that's turned into such a common problem where the doctors don't actually understand the medications that they're prescribing, so they can't help in the way you need, and it ends up getting labeled like something like that. So I think part of the fixing that could be done, I guess, that there has to be some different way or a different standard that we hold our doctors. Otherwise, nothing's ever going to change.
It's
Yeah.
crazy. They're making these people, like people that are struggling and suffering the most, they're turning a blind eye. People that are getting surgeries are not getting medication. What? Like, what? What do you suggest for someone that is having a surgery?
You get that prescription before you go through that surgery and you make sure you get it filled because obviously the biggest issue right now is pharmacies don't have your medication. And if they don't get your medication, you are not having surgery. We have to do this. We need to affect the healthcare industry's money by holding out on surgeries if they can't properly treat our pain. This is the only thing that we can think to do because everybody's so damn greedy in this country. Like, you're not going to, my spine surgeries on paper have cost over $1.7 million. I have a $1.7 million spine, guys.
Wow.
I know because my spine surgeon told me every time he does a surgery, like he did on me, he gets around $100,000. He's pumping out like 6 of those a day.
Wow.
So knowing that, okay, we have to affect their money for them to stand up and want to help fix this. Because like I've said, like we need you. You need us. Without
Correct.
us, there is no you.
And you
So-
know what it is? You never know. Like, no one's exempt. Just like addiction, no one is exempt. I could leave this house today and get into a major car accident. What's going to happen? A lot. Yeah, it's like no one is exempt from pain.
No, nobody is exempt from pain, especially in the United States where people are getting shot like crazy no matter what. Like, let's be real here, guys. It's dangerous in America and people have lost their minds. And you are one situation away from being in our shoes. And then you're going to come crying to me saying, I need help. And I'm going to say, I told you so. You should have cared what I've been
Right.
screaming. And that's what's been really hard. It's like, did I ever intend to join TikTok to talk about these things? Absolutely not. But my daughter, who is 14, is the one that told me to join TikTok to start sharing this information. My kid, a teenager. So
Wow.
it's like, I think it's wild where we're at as a society, because I do think, and I do know, because she's always has friends over. We have a lot of conversations. They follow my TikToks. They clearly are very well informed about this illicit fentanyl crisis. They're very well informed, and they don't understand it either. They're literally asking me like, well, I don't understand, they call me Miss Brandy. Miss Brandy, why can't you get your medication? I don't understand. So I try to explain it to them for them at their age. But this is concerning to these children because they know that as they age, things can happen, right?
Right.
And it's concerning to them because they're saying, like, well, what if I got in a car accident? You saying that they're not going to treat my pain? And I'm like, if things keep going in this direction, that's exactly what I'm telling you kids. So I already see that our youth are mad. They've been mad. They got mad in COVID. They were big mad during
Right.
COVID.
Yeah.
And we're now creating a generation. Like, I don't know about you guys, but when I was 14 years old, I didn't care about government. I didn't
Yeah.
care. You know what I mean? Like, I just didn't care. Who did? These kids are really having to grow up quick because they're really concerned about their future. And I think that's really sad. I
It
do.
is.
I think that's really sad because they can't be kids.
What do you do when somebody messages you and they're like, I cannot find a doctor? Isn't it supposed to be within a 50-mile radius of like your address for NARC score and all of that? Can you break that down for us?
Yeah, NARC score is an algorithm. For anybody that doesn't know, I suggest you could type in NARC score here. I have many videos about it. I pulled video from the maker, which is Bamboo Health, okay? But it's an AI algorithm that judges you in 4 categories and you are given a score. So, for a few years we've been hearing from one political party, we don't want this social credit score coming to America. It's already in America and it's given to us patients. We already have a social credit score. So this AI algorithm, unfortunately, it doesn't indicate the why. Why did Brandy have to travel more than 50 miles? Why did Brandy have to see more than 2 doctors? Why did she need 2 prescriptions? And you know what I'm saying? There's no why. It's just literally a system that's judging you on hospitals, how many doctors, how many pharmacies. So like how it's been personally affecting me is 4 pharmacies were out of my medication. So I'm at, the 5th.
Man.
So I was told, I had my pain doctor appointment just recently. Hey, Brandy, you can't go to any more pharmacies because of your NARC score. Because I'm already like getting up there. I'm going to get
So the
flagged.
doctors on their end can see that?
I can't say, people ask me what's my NARC score. I don't know. I haven't, and I don't care because I
Who
don't.
has access to it though?
From what I've been told, the pharmacies, the doctors, but I do know this. There are quite a few doctors that think the NARC score thing is stupid. Okay. But if you talk to addiction and recovery doctors, they're like, yay, it's good. But our doctors are like, this is stupid. So there's a lot of conflict there. And I know in Nevada, my doctors, they didn't use that. Michigan uses it. It's surveillance of the patient of why. But knowing that things are so tight now, anyways, this doesn't make any logical sense in how this is beneficial. Plus, if the pharmacy is out of my medication, I need to go to a different pharmacy. That's not my fault.
Correct.
we literally this narc score was designed for cops, guys. This is all for cops. This is for cops. Plain and simple. This is for the
Wow.
police. And we have now allowed the police into our healthcare system. And that's really what this is all about. Cops are dictating our healthcare.
Oh, that's scary.
Yeah. I don't
I
know,
can
man.
see why
It's
you're
too
so
much.
frustrated.
It's a lot, right? I mean, Lord, I know we've just been able to touch on a little bit, right? And there's so much to be said about all this. And I appreciate you all giving me the time to express these things, especially, to your side of the community, right?
Absolutely.
We're not looking, none of us are looking for drama, okay? We need help.
We need to try to figure out a way for us to come together more.
Of course, because at the end of the day, if you guys are, I have many friends that are part of the use community, and I've had to try to help them. One needs a spine surgery in her neck, and I was trying really hard to be like, hey, you need to give her some medication, I just, no, 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 no. And I feel really bad. I feel really bad because what I wanted to say, I know there's other people that they need surgery, okay, and they may have been in recovery, but those people deserve to have their post-op pain treated correctly. There's a way to do it. I know Dr. Ems and Dr. Nichols have talked about it, and we need more doctors like that to get on board because there's so many people that need to have surgery, and they're saying I can't have surgery because they won't treat my pain post-op. What are we doing? I mean, we're just causing more trauma, more problems in this country, and we're creating more chaos and more hate and fear within each other. And it's the government is if made a smart move. We're attacking each other, right?
Right.
And
It's all calculated. They're doing this on purpose to.
it is. It's not right against left, Dems against Republicans, guys. Enough. They're all fucking on some shit. Let's be real, okay?
If you were a substance abuse patient, if you went and got surgery, and then afterwards, like we had a program where a doctor or someone could check in, make sure your pills are being taken appropriately, and like maybe have to do that for a couple of months until you're off of the medication. Do you think something like that would matter, or would it just turn into, I don't know. I've thought about stuff like that before, but I don't know what would work.
I know if they gave me a contract saying, hey, Brandy, you got to do this right, do that right, and if you die, your family can't sue me. I will sign it, guys. Just let us live. Like, I
Right.
think a lot of us are willing to do a lot of things. I do think, that as a pain patient, it's been very obsessive, all of these urinalysis tests that they give us. I think it's crazy. I think doctors are abusing health insurance because they get paid like $600 every time they do an urinalysis on me. I think, again, there's a lot of greed happening within our own healthcare system and our health insurance. I think it's become too much, but we are jumping through these hoops and have been jumping through these hoops.
What about pain contracts? Because I know a lot of pain patients have to also sign a pain contract, like saying, you're going to stick with this doctor. But then I've had people messaging me like, even that doctor will not treat my pain now. And because that contract is signed, I can't go anywhere, nowhere. What? Can you explain that?
Yeah, that is a real thing happening. I mean,
That blows my mind.
yeah,
I've got
that's
so many people
real.
messaging me with those issues like that.
But again, where's the ACLU? Are you telling me these things are legally okay? Like
So
this
if
is
somebody signs a contract with a doctor and now all of a sudden something goes like that doctor doesn't want to, I don't know, like something falls through, how do you uncontract yourself?
Right.
I don't know that answer. In my personal opinion, I would just rip it up and tell the doctor to F off, and I would go to another doctor anyways. I'll be real with you guys. I think a lot of doctors are doing things because they think that you're not informed and you're scared. And
Right.
I think a lot of these doctors that they're betting that you are scared. And these things aren't legal. This is not a legal binding contract. And I'm just telling you what I would do. I would tell them to suck it. I know I'm a little aggressive, and I know I can come off that way. But at the end of the day,
You
there's
have to be, though. You
I have
have to be to get what you need.
you have to, I need more aggressive people out here because they are really hoping that you're scared and you're
Right.
misinformed and you don't know your rights. That's just my personal response. Like, if anybody can correct me on that, great. But from what I understand, I don't think these are like legal contracts. How could they do that in healthcare? That makes no logical sense to me.
At the same time, I think what they do, if you end up breaking those contracts, they can basically make it so you can't get anything filled anymore. You know, they can put in a bad word at the pharmacy and then boom, you're shot.
That's horrible.
Is that legal? Like, is
No,
that
no, not at
legal?
all.
But it's
But again,
happening. It
where
is
is
happening.
where's the ADA?
Man.
Like, where are these organizations that for disability rights? Like, what are we doing?
So if somebody is struggling and, how would you tell them to advocate? Or if they can't advocate for themselves, do hospitals have advocates? Like, could you call the hospital? Like, say you go to the emergency room and they won't help you. What do you tell people to do?
Oh boy. You can, there are like advocates for hire. Okay. Now, a lot of us, we are just, we're doing this stuff for free and I can give you advice. I mean, I don't, that's tough. I always recommend you don't go to these appointments alone. Let's start there. If you are a woman and you have a male that can attend these appointments with you, I know this is crazy, but it seems to be helpful when there's a man with you.
Right. I've experienced that as well, Brandy. I have. I know exactly.
Yeah.
They'll listen to the man before they'll listen to the woman sometimes.
You got to stick to your guns. You really can't let these doctors think that you are going to let them
Walk all over you.
walk all over you. We're in a tough spot, guys. I mean, there's really no easy answer here. Again, it's just like there's so many problems, serious problems happening. And there's not really easy answers for us because we feel like we're just getting attacked in every angle. And these people are predators and they just want to cause us more harm and more shame. And ultimately, the goal is they hope we just go away. And when I say go away, they're hoping that you just end your life and they never have to hear from you again. And that's the reality that I have come to live in, is that people rather see me die than to continue living a functional life with medication. And I don't understand as a country why we continue to allow this to happen, but more importantly, why anybody in any position within the government is not stopping this. And that's where we're dumbfounded. Yeah, I could tell you guys go hire a lawyer. Not everybody has this money.
Yeah.
I have a lawyer, but I've been trying to find us. We've been all been trying to find us a lawyer to take us pro bono. They don't want to touch it, or they want a $300,000 retainer. And it's just crazy to me that this opioid epidemic has gone this far, because if you dig into the White House's information, they openly admit this is an illicit fentanyl problem. I mean, they're going as far that they have in the White House. I took these screenshots. I will make these videos. I mean, they got all their countries involved. Mexican cartels, like, we're going to try to stop these cartels from bringing in this illicit fentanyl. But you guys, the answer is to have the DEA just totally stop legal medication. So the safe supply doesn't matter.
I feel like a few years ago, like 2016 and 2017, everyone did actually think that it was all about the opiates, and it was for a short amount of time, and then here in the past like 4 years, it's turned into illicit fent and trank and all types of stuff. That's what's unaliving everybody. It's
Right,
not the it's not just the pills anymore.
right.
So like we discussed the whole thing where they're going to cut back again. Has there been any reasoning as to why? Because that just it doesn't make any sense, like you said before.
At all. I can't find a darn thing, guys. And that's another thing. It's like if the freaking goal is to just they're gonna stop all opioid pills, medicine.
We'll be screwed.
Can they just say that? Can we just openly say that? Because we're literally digging and trying to find the why. So if the ultimate goal is no more, yeah, we are screwed, Marie. We are incredibly screwed. And this
And a
will,
lot of these doctors, their first go-to thing is injections. Oh my God. Like
yep,
with pain, and I've even seen like I've had those. I've been down that avenue. The doctor was billing like he was putting me to sleep. I was awake. I seen the insurance bill like he completely knocked me out. Lie. So I'm like, you know what? A lot of it is just money, money, money.
it is. I mean, the greed in our healthcare system is
It is.
destroying us, and we're just looked at like with money signs. It's not about our quality of life anymore. It's just like, how much money can I make off this girl? And it's sad, it's scary.
You do something with the insurance, your insurance, correct? You're on like a committee, right?
Yeah, I was just recently had my first meeting. I'm on
Okay.
on a health insurance board here representing the disabled population. So I'm just getting started with them. Now my goal is ultimately about, hey, we need to help more
Right.
disabled people with pain control. Because the scary thing about what I'm telling you is I don't even use their own pain clinic. I was told by my PCP that they would hate me because I use opioids. Like that,
Wow.
again, these are doctors' words to me. So, my goal is to try to change that. And I'm just thankful that they thought of me. But again, like me advocating and me calling I did because I'm crazy like this. I just didn't call them. I went down to their corporate office.
See,
And
I
I
love that.
walked in and I was like, yeah, like I was nice, but I was big mad.
But you know
And
what? They need somebody that knows and has lived experience to help them better what they could provide for you as a patient.
yes. And that's where our voices do matter,
Right.
and that's why I tell people to make these videos, talk about these topics. Like we're gonna get hate, guys. We all know you all get hate, Marie. I get so mad when these men come at you, just like leave this woman alone. Look at her. She's freaking amazing. She's a rock star. You changed your whole life. I
Yeah.
commend you, but we're always going to have those people
Right.
attack us. And we have to learn just to screw them. I don't like spending my time addressing a lot of these trolls. It's wasteful. I think a
I
lot of them,
agree.
yeah, because I do think a lot of them do it here
And it
intentionally.
and it distorts the message that you're trying to give because you
Yeah,
don't want to keep clapping back at people
right.
all the time because you want your message to be heard.
Right. Now, I think it's great to have if we can have open conversation and we can
Hmm.
try to help tell them like, hey, this is why that you are wrong. But, everybody's in attack mode.
Yep.
And I think they're just looking to ruffle our feathers and throw you off or
And
more
too
importantly,
sensitive. People are too
yeah.
sensitive.
Yeah, people really needed to just like look at the bigger picture,
Right.
look at the bigger picture of what's happening. And people need to admit what's happening isn't working. Because if people really care about addiction overall, then you're going to have to shut down every bar and liquor store. You need to get rid of cigarettes, no more sugar, and no more casinos. So, and no more sex because people get addicted to sex. So none of that, guys. Like these prohibitionists are useless people. It should, like prohibition is not the answer. It's never been the answer. Stop thinking that by getting rid of something is going to solve a problem, because obviously we are living through the time of prohibiting legal prescriptions has caused an increase in illicit fentanyl poisoning deaths. The
When I
data,
saw that on a graph, so I
yeah,
think Brandy Mack posted a video of like it was just like
yep,
zing right up.
data shows
I
it.
could not believe it. It was like, wow.
Yep, it's not the answer. And I talked about the Portugal model, legalizing and regulating all drugs. And at this point in 2023, America, get it together. Legalize the drugs,
I agree.
regulate the drugs, and let's
Safe
move on.
supply. Yes.
We're almost out of time, so I did want to ask, since it's been a little bit more heated and frustrating, what is something that you have been working on that you feel like is maybe going to actually be effective and is maybe going to help?
So I'm up in Lansing, often. I'm not just talking to Democrats, I'm talking to Republicans. I really would like to kind of see where independent people are standing, and I am looking to get somebody to just team up with me to really make and shake things up to make some legit change. Um, I make calls and send emails. I send certified letters. I will go knock on their door.
Can
I
you explain what the doctor patient forum is for
Yes,
people that might not know?
sure. The drpatientforum.com is a website, wealth of knowledge. It, disputes a lot of misinformation. Claudia, Morandi, and Bev are the, founders of this. I know Claudia may use some language that maybe a lot of people from the recovery community may not agree with, but I need people to understand where she's coming from, that there's a lot of beef between her and Dr. Kolodny, and she's kind of throwing back what he's done to us, okay? She supports all communities, whether it's marijuana, kratom, substance abuse communities. She's a loud voice. She's the loudest voice that we have for our community. She provides amazing information. We have individual state groups on Facebook. I help run the Michigan group. I'm always
Good for
putting out
you.
information of sign this or send this here. This is this person. Like, we're trying our best to keep pushing that information out. We're just a group of people trying to fix this disaster. That's who we are. I know that there's other pain advocates here, and there's pain advocates that don't associate with any organization. That's all okay too. We are just trying to fix and correct all the misinformation that's been spread about our medications, and we're trying to tell people the reality of what this elimination of opioid medications is actually what's really it's doing to America, and it's not doing us any good as a whole.
You're right.
It's been really positive for me to do this. I really am putting all my anger into this. So,
Okay. Hey, that's what we're here for. We're here for whatever
so,
you need.
but I appreciate you all giving me the opportunity, and especially, you two, Marie, me and you've been following the longest each other, and just supporting me, it means a lot. And
Same.
seeing the bigger picture of things, we are,
No, I do. I know that side, and that I understand that side so well because I feel like I'm both sides.
you are,
I could be both sides.
you
I
are.
see it. I've experienced it and lived it.
Exactly. We're better together.
Thank you very much, Brandy, for coming on. This has been a lot of fun. I'm glad you were able to air out your angers, and we actually, you had right here both communities coming together with no issues at all, because that's what it's all about. We're here to help each other.